It is about 3 a.m. Everything is quiet and peaceful except mom is awake and she is alert and you are tired. You want to rest, but she has needs. This is not a simple issue. This issue can rob you of your physical comfort. It can cause a lot of emotional discomfort and can definitely interfere with your thinking and next day working. If you don't sleep, you will not be able to help them. You will not be able to work, and the ultimate fate of your parent is going to the nursing home. My intention through this video is to take you through the journey that early morning awakenings are not normal, they are not physiological. This video is especially for you who are trying to take care of elderly parents at home. My name is Dr. Kulmeet Kundlas, and I've been a primary care physician for the last 28 years. Awakeness is a sign of something going on. We will explore and come up with practical tips. In my career, I have come across thousands of families who have been disturbed and they have been robbed of their physical comfort, has caused a lot of and definitely has interfered with their work to the point it becomes unbearable or very difficult to care for them at home. Why elderly wake up in the morning? It is a $1 million question and it has multiple reasons. We will cover this journey from physiological causes to pathological causes. Physiologically, as we grow old, our daily circadian rhythm changes. Elderly become tired early in the evening and go to bed early. Then they wake up early in the morning around 3 a.m. This disturbance in circadian rhythm is very common and it contributes to a lot of medical issues. If you have any kind of physical pain, especially chronic low back pain, chronic arthritic pain, that pain usually is worse in the early hours of the morning when every joint is stiff and painful and wake you up. If you have bladder problem, if you're a male, you may have enlarged prostate and you're getting up multiple times at night, and that will interfere with your urination. If you're a female, you may have urge or stress incontinence. Remember, we see the ad on the TV, I got to go, I got to go. That is urge incontinence. What's happening in both cases? In case of males, the prostate is enlarged and it stretches the prostatic urethra and makes you pee over and over, and you're getting up multiple times at night. In case of ladies, the bladder shrinks and the bladder muscle becomes hypersensitive. And every time there is a trickle of urine in your bladder, you got to go. Medications, especially sleep aids, pain medications, antidepressants, antipsychotics, and anti-allergy medication can cause early fatigue, sleepiness, and waking up early in the morning. Chronic medical problems like obstructive sleep apnea, BPH, urge incontinence, congestive heart failure, COPD contribute to early morning awakening. Psychologically, this could be an early sign of dementia. Persistent early morning awakening could be the first sign of depression. If you wake up and you're anxious and you're ruminating over and over, that could be anxiety. Combining both your physical ailments, emotional problems, cognitive problem can lead to early morning awakeness. As a family member pinpoint, if mother is awake and she's ready to go with her business, she's not tired, she's not sleepy, she's not yawning, this means it is a circadian rhythm problem that she has completed her sleep quota and now she's ready. If she's awake and she is ruminating about the past, present, and future and she seems nervous, that could be anxiety. If she's constantly getting up early in the morning, that is sign of depression. If she is complaining of urinary symptoms, aches and pains, or side medication, they all could be leading to early morning awakening. What are the things you need to do? Early morning awakenings must not be ignored. And you should not give Benadryl, Phenergan, or Tylenol PM. because these medications are not helping them. Talk to your physician, have them run proper tests for physical ailments, help them tackle anxiety, depression, or memory disorders, manage their chronic medical problem like COPD, congestive heart failure properly. What can you do to help them with their sleep? When they wake up in the morning, expose them to bright light. Have them sit outside so that their circadian rhythm is set up. We know as we age, melatonin level goes down. That interferes with the initiation and maintaining of the sleep. Low dose of melatonin is physiological and you must try. If you think they're depressed, use antidepressants. Anti-anxiety medication is a two-way street because if you take anti-anxiety medication, they will give you a rebound sleepiness during daytime, and that will again interfere with the sleep-wake cycle. Take safe and proper anti-inflammatory medications, bladder medications, and you will have proper sleep and you could rest. Let's work on to improve their sleep hygiene. Ensure that they are not given any kind of a stimulant like coffee, tea at least 6 to 8 hours before their sleep time. Maintain regular sleep time. Don't let them sleep at 5 o'clock and then whole dynamics gets disturbed. Ensure that bedroom is 1 degree cooler than rest of the house. It's dark, there is no sound. If they watch too much TV, intelligently restrict screen time. Use melatonin, mild exercise, and cognitive behavior therapy where you oriented them, they all have been proven to be helpful. I've been asked this question regarding sleep medication, when to use and when not to use. Categorically, sleep medications are not safe. And if you look at Beer's criteria, which is published by Medicare every year, all sleep aids are on Beer's list, which means they are not usually recommended. If you have done all the natural remedies and is still not producing, then you must talk to your physician and consider sleep aids after thorough examination because these medications can put your parents at high risk for falling. I hope this video was helpful and provided you some insight into why they wake up early in the morning from physiological to pathological reasons and what we could do. Like, share, and subscribe to our channel, Kundlas MD. Our aim is to simplify healthcare, and I will see you in next video. Thank you.